What is it like to sprint towards greatness when your own lungs are holding you back?
So tell me how you're feeling today.
Right now it's super bad. I have a horrible cough. On top of it, I have pretty bad exercise-induced asthma. They combine together, It's just a horrible combo. That alone today has really affected my performance.
When you watch someone run, you don't think about the breath it takes to get to the finish line. But for our guest, Olympian Shae Anderson, every stride has been accompanied by a challenge: asthma. I'm Dr. J. Rutland, and this is the Health Exchange. I've seen Shay's journey for the past 10 years as her physician, and today we're going to talk about how asthma challenged and shaped her. Let's get into it. Shay.
Hello.
It's been a pleasure to have you on the show. I'm so happy you're here.
I'm happy to be here.
We met almost 10 years ago.
Almost.
But, we know that when you came into the office, you'd had an episode of bronchitis, you guys were calling it, even though you had this diagnosis of asthma. But you were an athlete as a kid. What was it like to grow up knowing that something wasn't quite right with your breathing? When did you first notice something?
I started running track my freshman year of high school. And from my freshman year to sophomore year, I never really had anything stand out to me, as far as my breathing. But there was this one workout I remember specifically. I was doing 300 repeats, and I was supposed to do, I think, 5 of them. And on either the second or the third one, right after, I fell to my knees, and I just felt like my lungs were filling up with water, and I just couldn't breathe. And I was telling my dad, who was my coach at the time, I was like, Dad, I really don't think I could finish this workout. I can't breathe. I don't understand what's happening. I think I attempted to do one more. I stopped halfway and fell to my knees again. And I was starting to cry because I just didn't understand what was happening. I couldn't breathe. And then that's when my dad got scared because that's never happened to me before. So we ended the workout, and we went to the urgent care, I think, later that day after I regained my breath.
And you're 14 at this time or 15?
I was 15 or 16, around there. It was the end of my sophomore year, going into junior year, so that age range. And I went to the urgent care. They were just like, yeah, you have asthma. Here, take an inhaler. Take it whenever it happens again. And that was kind of it. We didn't really know the severity of it. We didn't know how to treat it. That's when later on in my career, I started having a little bit more issues. Same thing. Whatever respiratory thing I had going on, it wasn't going away. So my mom, she always does research whenever I go through things like this. She looked up, who's the best pulmonary doctor in Southern California? And you came up.
It's crazy, yeah.
And so I ended up getting an appointment with you pretty quickly. And you were like, yeah, you have pretty bad asthma. And you put me on a regimen. And then it kind of went from there,
Evolved from there. Now, when you were growing up, where did you grow up again?
I grew up in Norco, California, a small little town in Southern California.
Now, in that area of the world, there's always, over the summertime, we know this, there's always wildfires and things like that. When there was a wildfire, did you ever notice your breath being more short?
Oh, for sure. For sure. But I just kind of just assumed that was normal. I mean, I know it's not good for anybody, whether they have asthma or not, to breathe that kind of air. I also did realize I live by the 15 freeway. There's lots of trucks that travel that route. And I realized in college, I was taking a class. It was something to do economic-wise, but we were learning about different, areas and how it affects health and stuff. And the IE is actually not that best for air quality. So that was another thing that I didn't realize until I actually met you, when you told me I kind of have an allergy to pollution. And that's another, factor of my asthma.
Yeah, when you look at asthma in kids, first of all, 8 to 10% of children have asthma. We all know that asthma is allergic inflammation of the pipes carrying air to the lung. But 8 to 10% of kids have asthma. And then 90% of those kids that have asthma, which is where you fit, actually have exercise-induced bronchoconstriction or exercise-induced bronchospasm. So when you look at the lung, and I taught you this when you first came to the office, right? You have your bronchioles, which are surrounded by smooth muscle. And then you have these airway epithelial cells that line the bronchiole. And so whenever you take a deep breath throughout the day, your airway epithelial cells are constantly exposed to the environment, right?
Right.
And your environment's full of air pollution. It's full of grass antigen, which you're also allergic to, tree antigen, dog dander, so many different things, dust mites. And at any given point, your body can be allergic or have a reaction to any of those things.
Mm-hmm.
But here's the thing that people don't talk about with exercise, right? And you're running track.
Right.
So people who are exercising, and even my 12-year-old who has asthma, when she is exercising, she's hyperventilating. She's breathing faster.
Mm-hmm.
So what actually happens is as you breathe faster and you introduce this air through that bronchial, you're actually changing the temperature of the airway, and you're also changing the osmotics of the airway. And so when you breathe in fast like that, the moisture cools off. And all of those things in combination can lead to the release of inflammatory mediators. And when you get release of inflammatory mediators, the smooth muscle starts tripping and it starts contracting, and you have this exercise-induced bronchospasm, which is kind of what you were experiencing.
Right.
And it's, for me, when I hear your story and you're like, I was like 16 years old. I mean, you had to notice something before that, but you just thought it was normal.
Yeah. I think a lot of things I thought were normal ended up realizing that it wasn't normal. I think I told you I had like a deviated septum, my nose. And I remember I would always breathe out of my mouth like I couldn't run with my mouth closed. And I realized later on that that's actually not normal to breathe out of your mouth all the time when you're running. Like just after one rep, I couldn't breathe out like my nose.
And your dad was an athlete, right?
Mm-hmm. Both my dad and my mom.
Your mom and your dad. Okay.
Yeah.
What'd your mom do?
My mom was a figure skater.
Okay.
Yeah.
And your dad was?
My dad was a track athlete, decathlon.
And your mom and dad met like on that circuit? Or?
Yeah. Well, my mom, she was a professional figure skater. They had the same agent, and my dad asked the agent to give him my mom's phone number, and my agent's like, I can't give you that. That's my client's personal information. But my dad somehow
figured it
out. Yeah. And
so your dad and your mom meant a lot to you. They supported you a lot.
Yeah. So actually my first sport, I don't know if you even know this, but my first sport was figure skating. So I think as a young child, I always wanted to kind of follow in either my mom's or my dad's footsteps. I remember I actually found a piece of paper like last year when I was going through like my old stuff, and it was when I was like 5. I wrote, I want to be an Olympian, either the Winter or the Summer Olympics. So like even when I was really young, like that was a goal for me. So
that's pretty cool.
Like I didn't care if it was for the Winter or the Summer Olympics, like either in figure skating or running track. I like wanted to make one of those goals happen when I was young.
I remember the first visit with you when you came in with your mom and dad.
Mm-hmm.
And this is like when I was young in my career. I had probably been practicing at that point for like 2 years on my own. I had 2 small little kids, like none of them were athletic yet. And I remember going to work that day, new patient, Shae Anderson. I just remember it like it was yesterday. And your dad and your mom walk into the office. And at that point, I didn't see very many high school aged individuals, right? Like you're 16 years old at the time.
Mm-hmm.
And your dad walks in, he says, listen, doc, like, and he's got this tracksuit on, and he's tall, and he's got glasses, he's got brown hair, and he's just like, listen, doc, like, I don't know if you know this, she is a really good track athlete. I promise you, we're training her to be in the Olympics. She can be in the Olympics. She can be in the Olympics, right? And like, I'm gonna be honest, like at that time, I'm like, okay, dad, like whatever, like, I got it. Like, I'm gonna take care of her. Like, no big deal. Like, I'm gonna get it done. But at that point in my life, that was when I was spending a lot of time understanding immunology and the way that things communicated. And so like, I was really into understanding what was triggering inflammatory mediators, right? I started to like consult a lot and all this stuff. And so like you were kind of like and I wasn't going to say this then, but you were kind of like one of my first cases of taking everything that I had spent a lot of time on, putting it all together and applying it in a clinical scenario that led to a very positive outcome. And you'd come in and you had said you had bronchitis. Now, one of the most common mistakes that a lot of individuals make is they come in and they say, I've had bronchitis a few times. Now, let me tell you guys something. Like, you can't have bronchitis a few times. You either have asthma or you have chronic obstructive pulmonary disease. Like, bronchitis a few times just doesn't make sense clinically. So when physicians say that to people, I hate it. Like, I'm just kind of like, listen, give them a diagnosis so that they can understand what their illness is, right?
Yeah.
And that's kind of like where you fit. And so for me, it was like, all right, let me give her this diagnosis of asthma. So you get a diagnosis of asthma. I finally put you on inhaled corticosteroids, long-acting beta agonists. I put you on a regimen.
Right.
After we started that regimen, take me through that senior year.
Yeah. So I think when I saw you, that was about a month or a little less than that before my state championships. And that's kind of why we wanted to see you so urgently, is because I was having difficulty breathing. I was ranked number 1 in the state. My goal was to win state in 2 events that were back to back within 30 minutes. That was never been done before. So I was like trying to, do history, but I couldn't breathe. And so we're like, we have to figure this out. After you got me on that regimen, I still had like a little bit of like inflammatory problems, but I got it well enough to where I was able to win state in both the 400-meter dash and the 300-meter hurdles. And that has never been done before. And it felt impossible going into it because it was a long season already. It was my first like full season of running track without having an injury or, getting sick or something. So the fact that I was able to do that with also having those inflammatory problems like within that same month. So it seemed like the regimen you put me on like actually benefited me. It was, something I wanted to accomplish that year.
When did you first notice that it benefited you? Do you know you're like, oh, holy shit, I can breathe? Like,
yeah.
Was it a training the next week? Like, when did you notice?
I don't know if it was like the training next week. I just think like as that year continued, I started seeing way more progression. I remember just doing more of like the workouts that were more like cardio.
Strenuous.
Yeah, strenuous. Like those ones seemed easier. I was able to just do reps without like hyperventilating so quickly, so fast, because sometimes I would just do like 1 or 2 reps and I would be like already huffing and puffing. Like, so it seemed like that started to get easier and I started seeing like a significant difference as like the months kept going on.
Were you ever scared that you wouldn't reach your potential? Like, was it taxing on you emotionally because you?
Yeah, like I remember there was certain workouts like I wasn't able to finish because I couldn't breathe. And I remember even my dad, I think he was also scared too, because I don't think he ever experienced anything like that in his own training. So him not knowing like how I was feeling, he was scared also. Like, I don't want to put her through a workout to where she can't finish and then something extreme happens, like a really severe asthma attack happens. And so, yeah, there was definitely, spouts of fear that we've had like in certain workouts. And then also just knowing how taxing this sport is on my cardio. But I think as I continued seeing you, I think you kind of gave me, I guess, hope in a way where I'm like, okay, I think we could get this figured out to where it won't be anything, I guess, that like pushes me away from my goals.
It wasn't hard to treat you, but it was hard to get your dad to consider certain therapies. Because when you first came to me, you were exacerbating from asthma, and I was like, I got to put her on some steroids.
Yeah.
But when you look at the World Anti-Doping Agency, like, you cannot use corticosteroids during any competition,
Right.
by mouth or by IV or by intramuscular injection, unless you get some kind of an exemption, right? And so we had to really balance when we could put you on steroids because of your competition, right? We had to give it a certain amount of time to wash out. Otherwise, they would discover that you're on steroids. And you were not using steroids for performance enhancement. You were using steroids because you had
to perform.
Right,
just to perform.
Right,
Yeah.
just to perform.
Yeah.
So, we go through this. You break all these records in high school. So take me through like the recruiting process. Like, how did that
Well, I started track like my freshman year of high school, but I kind of, like I said, I was 5. I wanted to go in the Olympics, but I think as I got older, I wasn't pushing for that as much because, I just started track in my freshman year of high school. I remember my dad didn't even want me to run track. He's like, do you really want to run track? Like, are you sure? Like, I think he didn't think I was going to be as good at first. And then my freshman year, I tried out for the track team, made varsity. I made it to CIF Southern Section qualifiers, which, it's pretty good for a freshman. Never done the sport before. And I think that's when my dad was like, I see potential in you. Like, if you had some actual training, didn't just like throw things to the wall, hope it sticks, like you actually put a regimen together for your training, I think you could be really good. And I think at that point I was like, yeah, like, let's go for it. sophomore year, I transferred to a different school. I had some issues with that, had some injuries that came up. Junior year, I was actually training for the heptathlon. And so I ended up being homeschooled for a year so that I could train for that, because that's 7 events. So that's 6 hours of training every day that I
What are
would
the
have to
7
put in.
events?
7 events: long jump, high jump, shot put, javelin, 200, 100-meter hurdles.
Got it.
So lots of training that you have to put in, lots of weightlifting for the throws, lots of just, technique stuff for throws and jumps and everything. And then also you have to run on top of it. So I went homeschooled, and then we had some issues where I wasn't able to compete in like CIF because I was homeschooled. So there was like a whole thing. I ended up going back to my original high school, Norco High School, and I just had my breakout year. Like everything kind of aligned in that year. I decided to also just go with the 400. Heptathlon wasn't for me. I hated throws. It just wasn't clicking.
Yeah.
I was crying every practice. So I just decided, like, I really like the 400. Let's just stick with that. I also like hurdling. So 300 hurdles, why not? And yeah, I ran 51 seconds that year as a high schooler. That's an amazing time. And I kind of just came out of nowhere. Like, I remember all the track media sites were like, who is this person? Like, she just popped out of nowhere. And I was beating athletes that were like reigning state champions at the time. And they were like, who's this white girl that's just coming out of nowhere?
I was gonna ask you, yeah.
Yeah.
What's it? Because I mean, honestly, like for real, like, and this is interesting. Like, yes, I married a white girl and I got mixed kids. Yeah, get over it. But like, being a white athlete in a predominantly black sport, did that ever like affect you? Were the girls like talking shit?
I don't know. Like, a lot of it did bother me at first, because some people were like, there's no way a white girl could run that fast. She's taking steroids for sure. And that, I remember that bothered me my senior year, because I'm like, I'm skinny. Like, why would anybody think I'm taking steroids? Like,
That has an emotional toll on you, though.
It does.
It has an effect on you. Like,
it does.
I've never asked you this, like,
Yeah,
ever.
yeah.
But like, I thought about it, like when I was treating you, but I never wanted to bring it up,
Yeah.
right? Because I didn't want you to have to think
It
about
did
that.
bother me for maybe like a week, and then I realized, like, I'm running fast enough to where people are talking about me.
Right.
So I kind of just used it as like a pedestal in a way, and I didn't really mind it,
Did your parents ever ask you about that, or no?
Oh, my dad always knew about all of it. He was like, yeah, just ignore it, There's not much you could do.
No.
Everybody's also experienced that in their own way. And
But you you have this chronic disease that you just got diagnosed with.
Yeah.
You've got some people talking shit because you're a white girl running faster than them.
Yeah.
You got all these things happening to you at one time, and you still continue to push and be successful.
Yeah.
That goes to mindset and mental toughness.
Mm-hmm.
Where did you get that from?
I don't know. I think because now I've actually been dealing with a little bit of like setback from like my mental stuff now that I'm older. I don't know. I think when you're just young,
Ignorance is bliss.
I guess
like
so.
forever.
Yeah. I just wasn't thinking that much, I guess.
You were just training and running.
Just training, like, okay, this is fun. I'm in high school.
Yeah, and then you get recruited, and you get all kind of scholarship offers.
Yeah. So
how did that go?
Yeah, so that was weird, because usually for anybody that's in high school, they end up getting recruited like their junior year. They start getting interest early on in their high school career. But because I started running so late in my high school career, I was getting recruited also during that time when I was, getting talked about and having asthma. Like, there was a lot. And then I remember, because I started getting those like symptoms where I was having trouble breathing, and I felt like I was sick. And so I remember I was getting recruited by multiple schools, and I had to like kind of just tell them all, wait till the end of my track season, because usually they want you to sign like that spring. But that was when track season was happening. So I was like, can we just wait till after track season? I'll have my decision. And they all were like, okay. And so I ended up signing to the school I wanted to go to like a month before I started school. So.
And what were the top 5 schools that wanted you?
So it was USC, Oregon, and well, that was pretty much it. I mean, I got recruited by like LSU, Kentucky, but I didn't think I wanted to go that far away from home. So I kind of just wanted to stay. Oregon was the furthest I'd go. So I kind of just wanted to stay in this realm. I ended up transferring to UCLA, but that actually wasn't on my radar the initial time when I was getting recruited. But yeah, so I ended up going to Oregon on a full ride.
You go to Oregon, right? And like in my head, and I never said this out loud, in my head, I was like, I don't know. Because when you look at Oregon, especially Eugene,
Yeah.
surrounded by
The
all
pol
the trees and grass,
Yeah.
they have that like highest pollen counts in like the United States,
Yeah.
right? This was one of the things that you're
I
allergic
didn't
to.
know that, though.
I know.
I just thought it rained all the time.
Right, and I was like, and I remember actually I do remember having this discussion. I was like, because I think you or your dad asked, and I was like, well, it rains, and maybe that pushes all the antigen down in the dirt.
It usually does.
Yeah,
Like,
but you're
usually
running in the dirt, so like
Yeah.
you're lifting it up in the air as you're running. So
Yeah.
but it's a thing. Like athletes that go to Oregon that have asthma,
Mhm.
they have the potential to have more exacerbations. Like you can read about it.
Yeah.
It's not just the pollen counts and the grass counts and all of that in the air,
Mhm.
but it's also the wildfires that take place in Oregon too, because there's a lot of those. So
Right.
all of those things, and it actually does matter. So much so that University of Oregon has a little bit of a support system. Did you feel
Yeah.
that when you were up there?
Yeah, like, I remember because of the pollen, and then we have NCAA there, like,
Yeah.
our NCAA championships there, so and that's in the peak of pollen season, and so all these colleges come in, and everybody's just sniffling and not having a good time because
Yeah.
all the pollen. But I did deal with a lot of, like, sicknesses that came up. My iron level was extremely low. Got seasonal depression. There was a lot of things that kind of happened. I think I felt like I was sick the whole time I was there, but that could have been also allergies.
Yeah, you were sick a lot.
Yeah.
I remember this, and I remember thinking like, here's this athlete. She did so well in high school.
Mhm.
You set all of these records,
Yeah.
right? And then you're going to college for your next chapter,
Yeah.
and now you're up in Oregon, and I mean, you had my phone number, right? And so you're
Mhm.
texting me like every week that you just don't feel good.
Yeah.
And I remember putting you on a bunch of oral corticosteroids, not
Mhm.
just Oregon, but I think I had sent a few of those
Right.
prescriptions up there too.
Yeah.
So then we did something, right? So
Mhm.
what happened then? What do you remember then?
When I came back home from Oregon, well, I came back for a lot of things. One, I needed to come back to sunshine because I think my low vitamin D levels was also another reason why I was sick. Like, they all kind of just go together. So I needed to come back to sunshine. And then I saw you,
Yeah.
and then that's when I started Dupixent. And since then, I would say all those, like, spouts of fear that I said I had originally, I think those have kind of gone away when I do workouts. I don't fear having any, you know, episodes or anything because I actually haven't had any since I've been on Dupixent. So that has been, like, a huge game changer.
When you look at a patient like Shay, so she had severe asthma, she had a little bit of an eosinophil count, so the allergic cell in your body was up. And then she continued to need oral corticosteroids. And so when you look at the different sort of newer therapies, biologics, right, which are monoclonal antibodies that inhibit certain inflammatory mediators in your body to calm down the systemic inflammation that contributes to your asthma, she was a perfect candidate for dupilumab or Dupixent, which was indicated for oral corticosteroid dependent asthma, which she was because she was taking oral corticosteroids all the time. So here's the thing, though. This girl was training to go to the Olympics. And so, in this new world of treatment regimens for asthma, and her having to manage when she could take steroids, when she couldn't because of the anti-doping agency, I also had to find out if Dupixent was cool, if she could give herself an injection because it's an injection every couple of weeks, right? So I had to go through all these things, email people, and we figured out that it was all good. We put you on it. You clearly responded well. And then you transfer back to UCLA. What did that do for you mentally? And what did that do for you physically?
Yeah, so mentally, I started getting back into the swing of things. I think that seasonal depression kind of lingered a little bit. And then also, coming back from Oregon, I came into UCLA with a stress fracture in my spine. So, right when I got to UCLA, I actually wasn't able to compete that whole year again. So, I just mentally, I don't know, I was going up and down. I was back happy being home, but dealing with injury that was kind of severe,
Mhm.
stress fracture of your spine. And with the recovery on that, you just don't do anything for 10 weeks. So I couldn't even do biking. I couldn't even do core. Like, I couldn't even keep myself in shape.
Wow.
So that was weird. But I think academic wise, it was actually good for me to get a sense of what the academics are at UCLA because it's very different from it being in Oregon. It was way harder. I remember going about it the same way I did in Oregon because I was a pretty smart kid, I would say, and I didn't really have to study much. And I kind of did that my first quarter at UCLA, and I failed all my midterms. And so I kind of used it as like, oh, I need to actually apply myself academically, and went to office hours every day, ended up bringing all my F's to A's by the time the quarter was over. So I think it was actually like a bad but a good thing at the same time, because I was able to, have a better transition, not have too much going on that year. And then that's when you put me on Dupixent. So obviously I wasn't training hard, but it was just a good like little transition year. And so then the next year, COVID happened.
Yeah.
And so that was like another year that kind of just set me back, and like, okay, at least we'll have an extra year to train for the Olympics, because, it got pushed back a year.
Yeah.
So, a lot of I've gotten hit by a lot of things that kind of set me back, but I feel like now looking back at it, it was kind of a good thing. And, I'm always somebody that thinks things happen for a reason. So,
One of the things that I actually love to hear you say, and most people don't realize this, and for you college kids and even for you med school kids or graduate student kids, I want you guys to listen to this. One of the things that she just said, and I'm just shifting to academics for a quick second, is she said, I failed everything. I started to apply myself, and I went to office hours.
oh, office hours is huge.
Office hours, you guys, huge. It's not for the teacher. It's for you to learn how the teacher thinks and what they think is important. So you spend your time in office hours, and you essentially get the answers to the tests. You get what they think is important, what they want you to get out of the lesson, because you're one-on-one, and they're just talking, just like I'm talking to Shay right now. So I think that office hours are probably the single most important thing you can do in college.
And you build a relationship with them, especially if it's a professor that you have in a huge lecture class. You don't end up talking to them most of the time. So it was like a good way to actually have the professor see your face to your name. And then when they're putting a grade in, like, they actually know who they're grading. So I learned that then, which I was actually happy to learn early on going to UCLA, because that would have been hard if I didn't go to office hours. I learned early on that is very beneficial for you.
100%.
Yeah.
Now it's time for What's the Buzz, presented by BuzzRx. Every week, I answer a health-related question from one of our viewers. This week's question: why are some people prescribed pills for asthma instead of inhalers? This is such a great question. I think what people need to understand is asthma is inflammation of the pipes carrying air to the lung. The first thing you need to do is prescribe inhalers to calm down that inflammation and to relax the smooth muscle that's being irritated. When you think about pills for asthma, really what we're talking about are pills like antihistamines that calm down inflammatory reactions. They're going to calm down that allergic reaction to certain antigens that somebody might be allergic to. There are future pills coming for asthma therapy in the future, but they're not quite here yet. That's the buzz. If you have a question, email us at healthexchangepodcast@gmail.com. Thanks again to BuzzRx. Look up your medications on buzzrx.com or the app to see how much you can save. So we're at 2019. You transfer from UCLA, from Oregon back to UCLA.
Mm-hmm.
You're injured, so you don't compete that year.
Right.
Then 2020, it's SARS-CoV-2 infection, pandemic, whatever.
Right.
You don't compete for that year. The Olympics get pushed back because your goal that you wrote down when you were 5 years old was to be in the Olympics.
Right.
So now we're in 2020. We're getting into 2021.
Mm-hmm.
I want to hear about the ramp up to that training and what happened.
Yeah. So when we kind of heard that the Olympics got pushed back, all the gyms, all the tracks were closed. But luckily, my high school track allowed me to train on. We had access. We had a private key. So that was sick. And then my dad went on Facebook Marketplace and he bought bumper plates. We turned our garage into a full-on Olympic gym. And so I basically got all the training I needed to when I was at home, whereas some people weren't able to train. They didn't have access to like certain things that I did. So that was a huge thing for me. So I was able to still train during 2020 and, build up from that year I didn't run at all. So that
You never invited anybody else to train with you? Like nobody, you didn't say, hey, come?
Well, COVID.
Oh, that's true.
I did invite a few close friends.
Yeah.
So it was actually good because I didn't have to be by anybody. I didn't have to worry about getting sick.
But wasn't it nice to be kind of like in your own zone?
It was.
And not have anything and just like
It
focus.
was. And then going into 2021, because COVID was still, everything was opening up a little bit, but classes were still online. So that was huge too, because we was able to train whenever I wanted to, still put a little bit more focus on my training than I was academics at that time. So it kind of like COVID, honestly,
It was a blessing.
it was a blessing for me, And so I was still able to train at home because everything was online. So I still had that private track situation. I still was able to lift in my garage. 2020 and 2021, I just grinded training. Like that was all I did. Grind, train, do online class. Everything was like perfect. And so when it was Olympic year,
What year was it?
2021.
So we're 2021 now, Olympic trials.
Yes.
And where are the Olympic trials?
In Eugene. And I think you also put me on.
I did. I gave you steroids before, I think.
Yeah. I also was having issues. I think, oh gosh, I always just have like little minor things that pop up. I think I also told you like qualifying for NCAAs before that, I got eaten alive by mosquitoes in College Station, Texas. And I had to get steroid injections into those because they were infected.
Mm-hmm.
And so I always just have little like minor things that pop up. I kind of just ignore them at this point, or they don't really faze me because I'm like, it's just me.
Yeah.
I have a little bit of bad luck, I feel like.
Mm-hmm.
But anyways, going into the Olympic trials, I just at that point I was like, you know what, let's just have fun. Like the fact that I'm even at Olympic trials is a big deal. So first round I got second in my heat, so automatically went to the next round. But usually when you do heats, you don't want to run your fastest. You want to like do enough to get to the next round, really. Yeah. When semifinals comes, I was in the same heat as Allison Felix. And so I kind of she was right in the lane in front of me. So I was like, perfect. I could just follow her the whole time. And so we both crossed the line, and we both made it to the final. And so this year we had the mixed relay got put into the Olympics. And the mixed relay is basically the 4x4, but there's 2 men and 2 women. And so because of that, they bring extra people that year in the relay pool. And so this year, just making it to the final, you made it to the Olympics. But only in the 400 because no other events have like relays.
I can't believe you're saying but so like when you're running that, you place in that heat, after that race is over, holy shit, I'm going to the Olympics.
Well, so some people were like, yeah, you just making to the final this year, you made it. But I didn't want to like believe it until like somebody actually told me you're going to the Olympics.
Yeah.
So like even after that race, I placed 8th, so I was last in my heat.
Yeah.
After I was like, did I make it? I don't know. I think I made it. I don't know. I didn't know if I wanted to like celebrate. And then somebody came to me, handed me a card, and he's like, congrats, you made the Olympic team. And so that was like very surreal.
But what did that moment feel like? Like you're at Eugene, Oregon, where like you're like again, like yeah, high school, you killed everybody, you got there, but you're at Eugene where you actually started your track career in college.
Yeah.
And you get handed this card. Is your dad there?
Yes.
I think your dad was there.
My dad was there.
Didn't he is that when he got sick?
I'll talk about that.
Yeah. Okay, wait, so your dad was there.
Yeah.
And your mom was there.
Mm-hmm.
And you get handed this card. Are you next to them or are you?
No, I was like in the like athlete zone area.
Yeah.
So basically after you finish a race, you go through like a zoning area where you get interviewed and then, you cool down and then you could go see your family after you finish doing that. So I was pretty much by myself. My dad was outside of the zoning area because he was a coach. So he was able to be in like the athlete area. But it was like kind of surreal. I remember it was the goal to make top 3 because when you make top 3, you go individually in the open 400.
Yeah.
And so I didn't do that, but I made it in the relay pool, which I still was able to go to the Olympics. So I was like feeling mixed emotions. That year, I ended up also entering in the 400 hurdles. And so the 400 hurdles was 5 days after the 400. So the goal was to rest up that next 5 days and run the rounds for the 400 hurdles. So at that point, I was like, maybe I should try to make top 3 in the 400 hurdles. And so that was a goal. So after we like went to dinner, celebrated, and then the next day, my dad started having extreme pain in his abdomen. He couldn't walk. Well, he tried to walk, and then he went septic. My mom's a urgent care warrior. She wanted to call urgent care. And when I saw my dad shaking, I was like, Mom, this is beyond urgent care. And so thank God I was there to make that call. So we called 911. Then that's when we realized his colon perforated. And then at that point, everything kind of changed. I was like, my dad's in the hospital. I was also tired. My legs were shot. I was exhausted from the season. And then I think I was also in shock from my dad's situation. So that's when we kind of just decided, let's just, call it as far as the Olympic trials and then just get ready to go to Tokyo.
There are individuals, and you obviously are one of those individuals, when you have asthma, which is, again, allergic inflammation of the pipes carrying air to the lung, you also have kind of this tendency to get overinflamed when things happen, right?
Yep.
So whether it's your sinuses, which we call allergic rhinitis, and chronic rhinosinusitis with nasal polyposis, which I think she had as well, and whether she had dermatitis, like you heard about her getting mosquito bites leading to a significant reaction and her having to be on prednisone for that, which is, again, the treatment for a severe dermatitis. All of these things go hand in hand. And so asthma rarely is just by itself. There's always something else that's happening, which explains why you were sick kind of all the time.
Right.
But I think when you made the Olympics and your dad texted me and told me that, and then the next day he was ill and we had to take care of that, which was taken care of.
It was.
I never really had the opportunity to say congratulations and way to fucking go.
Thank you.
So I'm going to say that now.
Thank you.
Like,
appreciate it.
To have known you since you were 16 years old, and when your dad walked in my office and said this girl's going to go to the Olympics, for you to actually achieve that goal, which means you're one of the best athletes in the world, despite whatever it is that happened, despite you being sick, despite you saying, oh, I didn't go to the 400 or I didn't, whatever. Congratulations.
Thank you.
That was amazing.
Thank you. I appreciate it.
And I think that's an unbelievable feat. I mean, you're an Olympic athlete. Nobody can take that away from you. Ever.
Yeah.
Which I think is amazing. We're going to call this segment the sprint. This is going to be rapid fire questions. I want you to answer them just right away.
Okay.
If you weren't a runner, what sport would you have played?
Tennis.
What's always in your gym bag?
My inhaler and ibuprofen.
Which inhaler?
My albuterol. No, my Air Supra.
What's your favorite victory celebration?
Probably going to see my family after and giving them a hug.
Your dad? Your mom?
Both.
Who gets the first hug?
My dad, usually, because he was always in like the mixed zone. So
yeah. Who would you love to race against in any event?
In any time?
Anytime.
I would say like Jackie Joyner.
Was that your favorite athlete? Is that who you looked up to when you were growing up?
No, actually who I looked up to was Allison Felix, and I did end up running against her, so
yeah.
That already happened.
So I already did that. Next.
Yeah,
okay.
So I did look up to her, so that happened. So I guess the next one would be Jackie Joyner Kersey, who actually trained with my dad.
Oh, wow.
When my dad was at UCLA, so and then I just like what she's done for the sport and how she's still so involved with it. So
that's awesome. What's your best race memory?
Running against Allison Felix. So that race, after we exchanged like a handshake, and I have a few photos of it. I actually have one in a frame, and sometimes when I doubt myself, I like look back at the picture and feel like I made the Olympics the same time Allison Felix. Like was this athlete at one point, and sometimes when I doubt myself now, like I was this at one point, I'm still that person. So I like to remind myself of that.
How do you describe what it feels like finishing a race with asthma?
It's a good feeling to know that I finished. I feel like because I have asthma, I tend to have a little bit more lactic acid buildup because of the oxygen in my blood and how that affects lactic acid and all that stuff. So sometimes a little bit more painful than I feel like other people experience. It's good to know that I finished.
That lactic acid thing hasn't really been proven in asthma, but I get why people say it. Training solo or with teammates?
I would say solo earlier, but now I have training partners and they truly make training fun. When I was training solo, like those couple years, it felt like a job, which it is, but it just felt a little bit too serious sometimes. And sometimes it's nice to just, share a laugh or just be unserious for a little bit. And so my training partners, they're very inspirational people to be around. They're just great human beings all around. And we joke around, have fun, push each other. So it's been a really good experience.
One mantra you'll carry into the next chapter of your career?
Have fun. It's never that serious. I think when I start to get too serious about it, then I stop having fun, and then that's when I start overthinking, getting anxious, and all that stuff. And no one's forcing me to run track, so as long as I'm having fun, then that's the most important thing.
So you're from this small town, Norco.
Mm.
Now you're at the Olympics. I want to know what that was like.
So my dad's thing kind of lingered on for a
Yeah.
while. So I was actually training all by myself. And then I end up getting a call because my goal was to, I was still going to Tokyo. I got a call and they made this new rule where they're only going to take 7 people, but well, they're taking 8, but 7 people are runners and then I'm the backup.
Mm-hmm.
So that was really hard. Another thing, like I was going through that whole thing with my dad and I wasn't feeling great. My back started flaring up a bit. So I think that kind of happened for another reason that who knows. But yeah, it was kind of hard, like going all the way over there and experience everything. It was kind of like imposter syndrome in a way. Like I'm here, but I'm not running,
But you're there.
But I was there.
You
Yeah.
got to train there.
And I got to train there.
With
Got to
other-
do everything. I still do like the relay exchanges, like at camp and stuff and all that. And the relay coach, she really wanted me to be on the relay, but they just like passed this rule. And so
What was the call?
just that like every team had to have an alternate and that they could only have 7 people as like the official like relay pool team.
Oh.
And then also, well,
So somebody
that
had to
kinda-
be sick for you to actually run the relay
right.
or something.
Or injured
Or
or
injured.
whatever. Yeah.
And nobody
then,
was like, my hamstring hurts.
right.
Yeah.
But the thing is, they could have like chosen anybody to be that,
Yes.
and they chose me because I was 8th in that final race at U.S. trials. But it's been weird because in the past few years, they've been doing things a little differently, and they've been changing up the order of who they choose it to be like an alternate. So that's a little weird. I don't know. Lots of politics that go into it, but I don't really have control over that. But again, like I said, I don't know how well I would have been able to compete anyways with all the stuff I was going through and all that
Yeah, because
stuff.
your dad got really sick.
Really sick. And
Take me through that. I mean, you're not emotionless.
yeah.
But when you call me and you tell me your dad is sick, or when your mom calls
Yeah.
and say your dad is sick or whatever, and I'm dealing with it. I mean, you're kind of like pretty stoic. You're just like
Yeah.
even.
I try to be. I think because like stuff like this happens a lot with my family.
Yeah.
But I don't know. I just feel like in certain situations, I feel like I have to like hold myself and kind of just like keep a level mind sometimes.
But during the
But
Olympics,
then when I'm by myself, I like
Break down?
Break down. Yeah,
Do you?
for sure.
this is a hard question.
Okay.
This is a very hard question.
Okay.
Do you think that it was the lack of your coach's push or the absence of the person you hugged after a race that affected you more during that time?
I feel like a little bit of both because, it was my dad. I think it wasn't even the lack of motivation. It's just like I had so much on my mind of all of it that I just felt like I couldn't focus. So it could have been like a little bit of both. Like my dad always is pushing, yelling at me in practice, and that I feel like helps motivate me. But then also when I go home, like my dad's also not there, so like just the whole day, like when he wasn't there, felt weird, So I feel like about 50-50, and that's kind of how my dad and I's relationship has been. Like he's always been like 50-50 dad and coach. Sometimes there's a little bit more coach to dad ratio, but
As a father of athletes, about a week ago, one of my boys, Marcus, he called me
mhm,
and he started screaming at me. And he was like, Cedric, he's known me since I was like 11 years old.
mhm.
Right. And he was like, Cedric. I was like, yeah. He's like, I know you're not watching film with your daughter. Like we were watching soccer film and I had like posted it.
Mhm.
And he was like, bro, you got to be dad. He's like, you can't be coach and dad.
Yeah.
He's like, you got to be dad, bro. Like, he's like, she's a little black girl. She's been going through things. Like, yeah, okay, I get it. She's mixed, but she's a black girl. Like, she'll be going through things. You got to be dad.
Yeah.
You got to be dad. You can't be coach. And I listened to him and I'm like, man, shut up, Marcus. Like, I got, whatever. I got to be able to do both. Cause I look
Yeah.
at your dad, for me, a little bit as like the model, right?
Mhm.
And I guess my question to you is like, what was that like growing up? Were there times where like you wish that he was more dad than coach? And did that bother you? Did that affect your relationship?
Yeah, I feel like anybody that has a parent as a coach always experiences kind of similar things, like where you don't feel like you get a separation from them sometimes. Like when we go home, he would want to look at film when I didn't want to. Like, I wanted to just relax in my bed and just not think about track. But he also loves track. So he enjoyed that part, you know? That was, like, his favorite part of, I think, being my dad, is the fact that we shared the same interests, and that was one of his biggest interests. So it was hard just, like, not having that separation sometimes when I wanted it, so, like, boundaries were a little bit hard, but it was also good in the fact where he knew me the best
Mhm.
compared to any other coach. Like, he knew when I had my cycles, he knew when what I ate because he was with me, like, you know? Or he knew how I was feeling, and certain things we could adjust and make certain calls on workouts because of, you know, things that other coaches might not be aware of because from me, just because we're not as close as like my dad would be. So there's definitely like pros and cons to it, and you know, it's just all about like finding that perfect balance, which is really hard.
Now, I've given you medical advice on what to do for your asthma.
Hmm.
I've given your dad medical advice. Your mom got sick recently. Mom, same thing.
Hmm.
But I want you to give me advice on how I'm raising my athlete children.
I think the best way is just to listen to them, and sometimes just whatever you think is best might not be what's best for them. And at the end of the day, if it's for the purpose of having them succeed in a sport, it has to be their way. Otherwise, they're going to lose interest, lose the love of it. And if they end up not loving it anymore, then there's no really a good reason to do it anymore, because once you lose that interest and love for it, then you start losing motivation, and then that's a really key factor. I think it's all about just, like, listening, boundaries, balance, all that.
You know, it's so interesting when you sit and you think about it, like, think about our relationship as like patient and doctor.
Mhm.
And, you know, I sort of think of all these questions about you being the patient, me being the doctor, how we've kind of helped each other. What have you done for me as a doctor? What have I done for you as a patient?
Mhm.
But the way that life has evolved, you know, you've impacted my life positively in so many different ways because of the fact that my kids happen to grow up and now they're athletes now. And
Mhm.
just listening to you
Yeah.
talk about your dad
Mhm.
and the impact he's had on you, but also the things that maybe you felt like, you know, could have done a little bit better.
Mhm.
And I can apply that directly to my daughters, right?
Mhm.
So your dad now healthy, doing fine. Mom healthy, doing fine,
Mhm.
right? Your dad doesn't coach you anymore.
Mhm.
What are you doing now? Who's your coach? What's your future goals?
Yeah, so, well, we made the reason why my dad doesn't coach me anymore is because my mom had a heart attack. She had to get a quadruple bypass surgery, so it was a very extensive surgery, and with that, we had to make some lifestyle changes, and one of those is I really wanted my dad to be there for my mom, because when my dad was training me, he was in LA with me. My mom was at home taking care of the finances, the house, taking care of my brother, and having just a lot of responsibilities that isn't fair to just put on one person. And so I was really just pushing to the fact that he needs to be home with her, you know, and especially at this time. And especially for him, you know, he also needs to focus on his health, and I feel like he was so focused on me. Both my parents, they were so focused on me that they weren't really focusing on themselves, which is also important for them, you know, to stay healthy. And so it was kind of an eye opener for me, because I was like, this is my goal and my dream. And I feel like, yes, my parents are very supportive of it, but I felt like it was like an unhealthy, you know, level of support to where all their lives kind of went into me. And so I made the call to join a completely different training group, allow me to have, you know, my dreams and continue pursuing them, and allow my parents to be my parents, and, you know, have that, like, I guess in a way, normal family dynamic again, to where they're my parents. And so I made that call. I'm in a training group now. I still train at UCLA. The new head coach at UCLA, Joanna Hayes, is my coach now. Shout out Coach Hayes. And like a few Olympians in my training group also. Rye Benjamin, who won the 400 hurdles in the Olympics last year. Jasmine Jones, who got fourth in the Olympics last year in the 400 hurdles. Also Raven Rogers, who got third in Tokyo in the Olympics. So we have an amazing group, and we all get along so well, and it's so nice to like have people to push me, because a lot of the times I was racing against the clock in my workouts, and so now I actually have people to run with, which is what it would be like in a race situation. So it's nice to kind of just get it. I feel like this year I've been in, like, not in a uncomfortable zone, but it's different to what I'm used to. And I feel like it's kind of pushed me to a different area of my training. And this was kind of a transition year for me. And so I'm excited to bring that into next year and continue on that same path. I've dealt with a few injuries like that. My back injury that I've had in 2020 or 2019, it flares up here and there. I have some bulging discs that cause problems and SI joint pain and all that stuff. And so the goal is to just get that handled and to where that's not anything that flares up again. And I just feel like once that's taken care of, then I could have a successful rest of my career. And 2028 is coming, which is the LA Olympics. And so the goal is to make that one for sure. I feel like that one's my year to shine, back where I grew up, and the Olympic Village is going to be at UCLA. So home. Like I could sleep in my own apartment and go to the track and run. So I just feel like that's the main goal right now. Is just focus on that. So now that I'm here, I actually have a few questions I have to ask you. Do you remember the first day we met? And how have you seen me grow over the years?
I mean, yeah, of course I remember the first day we met. I remember meeting you, your dad, and your mom. Here's the thing. When you first came in, I felt like I was meeting your dad and your dad's perspective of you.
Sure.
Right?
Yeah.
Over the course of the years, you and I have been able to communicate, and now I got to know you a little bit better. And I sort of have watched you go from this quiet, unconfidently confident athlete that said nothing to this independent Olympian who knows what's best for herself. And it's been awesome to watch that happen.
Yeah. So how did it feel to treat me as one of your first athletes that have asthma?
It wasn't just the athlete thing for me. It was more of the pediatric thing.
Right.
Because at the time you were 16, so you're still pediatric age. And I had begun to notice that pediatric age patients were not treated very well for asthma in the area. They were just thrown these inhalers. And so I just kind of took you as a model in my mind as how I was going to apply what I knew about asthma to pediatrics. And so you were kind of like the first foray into that. And so you motivated me to be more aggressive about teaching asthma to pediatric parents. And I loved it. So thank you.
Have you learned anything from my case specifically?
Yeah, I learned a lot about the World Anti-Doping Agency and like the Olympic Committee and what you couldn't be on.
Yeah.
I mean, I've had actually a few athletes call me and I've taken care of since you. And I think they had heard I was taking care of you.
Okay.
A couple 100-meter guys. And so I've treated them as well. So yeah, I think having the experience of taking care of an Olympic athlete matters because of all the rules surrounding what they can and can't be on, considering, asthma and steroids and all of that. So yeah.
Yeah, I do remember when I first saw you and you suggested the steroid inhaler. We're like, steroid?
Yeah.
Can I take that?
Right.
Yeah.
And inhaled steroids are completely fine.
Right.
Like you can take all the inhaled steroids you
Except for you can't take like a certain amount of puffs. Like you can't take like 10 puffs of it for your race.
I mean, you're
but
not supposed
I would
to
get
take
lightheaded anyways.
Yeah.
Like I wouldn't want to do that anyways.
Right.
I would not be able to race.
At the time, there was no like really acute steroid inhaler that you would take before a race anyways. But yeah, that's true.
Right, true. So you don't have that many patients where you give your phone number. What made me so special to where I could have that?
I think it was your dad, because your dad was so concerned about your well-being in the beginning in terms of having the right therapy for asthma. And because like after your dad told me all that and I looked you up and I was like, okay, wait, she is kind of like an elite athlete. It's an outdoor sport. She has bad asthma. I need to make certain that I understand what her triggers are. I felt like the only way I was going to know all of that was by giving your dad and yourself kind of personal access. And you guys, nobody ever abused it. It wasn't like your dad texted me all the time.
Right.
But I think that actually led to better asthma care for you and truly understanding what you needed to be as successful as you are.
True. And then also me having his number, he's allowed me to call him whenever I have COVID, whenever I have allergy related stuff. And then when my dad got sick, he was the first person to call. And then when my mom had her heart attack, he was the first person to call. So it's been truly a blessing that you given me that. So then you could give us your expertise, because you're like one of the most, well, we're able to trust you the most. And we really appreciate your help with all that stuff.
I mean, listen, it's been an absolute blessing taking care of you, taking care of your family, watching you grow. And it's going to be an absolute blessing watching you run in the 28 Olympics.
Yeah.
Um,
You better be there.
I will be there, no
You still
doubt
haven't
about it.
watched me race.
I have never watched you race. Actually, I have watched you race online.
That doesn't count.
I know. I've never watched you race in person, but I promise to do that. Shay, where can we find you? Not where you're running and practicing, but where can we find you online?
Yeah, you could find me on Instagram, TikTok, at Shay, SHAEE.Lynn. The same username for Instagram and TikTok. I'm pretty active on there. You could see little updates. Soon I'll be starting YouTube, but if you follow me on those, you'll be able to see when I start that.
Perfect. Thanks for watching and listening, you guys. We're on Instagram at the Health Exchange Podcast. We're also on Apple, Spotify, iHeart, YouTube. Find us there. Get us wherever you get your podcasts. We see you every Thursday at 6 a.m. Pacific, 9 a.m. Eastern, and we'll see you next time.